Hi, in this lecture, we're going to look at the clinical applications of the skeletal system. And of course, we're going to start with fractures. So what is a fracture? Well, a fracture is literally a broken bone. It's when some sort of force is going to push on the bone and the bone can't withstand the tension and it's going to break. There's different types of breaks that can occur. One of the more common ones is just called a simple or closed fracture, which is sometimes called a clean break. These don't have to be manually put back, or you don't have to try to move the bones back together. They usually heal very well. A compound or an open fracture, notice though, is when a piece of the bone breaks through the skin. So these obviously have to be put back together. And a concern with this is that once you open the skin, remember that's your first line of defense, you have to worry about infection. Now, a stress fracture is due to overuse. So basically just repeated force over and over and over, usually in your lower leg or your feet, is going to cause, sometimes they kind of describe it like a small crack in the bone, and that's usually just due to the repetition. Now, other special types of fractures, comminuted is when it fractures into splinters, into pieces, so 3 or more fragments. So these are going to be pieced back together again. You're probably looking at some screws and devices to hold the bones together so they heal. Another sports injury is a spiral fracture, and you can see a spiral fracture of the tibia. So this is due to a real strong twisting force. So maybe you plant your leg and you twist to switch direction when running. A green stick fracture is very common in children. If you've ever bent a green stick, a live stick, what you'll notice is that one end bends and one end breaks. And children have more collagen, their bones are more flexible, so this is common in childhood. An epiphyseal fracture would be at that growth plate, the epiphyseal plate. And this is a concern because when bone heals, bone basically replaces cartilage with bone. So these are going to be watched pretty closely to make sure that the bone doesn't grow into the growth plate. And one that you've seen already is an avulsion fracture. Avulsion is when a piece of bone is broken off, and you can see a piece here of that medial epicondyle, and here's a little piece here of the lateral malleolus on the fibula. So often these need to be screwed back together again, but if it's very, very small, they might just leave it, and your body would reabsorb it because it'll break down. So if you have a fracture, how does it heal? Well, there's 4 steps for healing a fracture that I want you to know. And the first step is you get a hematoma. Blood is vascular. When you break it, it bleeds a lot. And so you're going to get a blood clot. So a hematoma is a blood clot. It's going to fill in the gap between the broken ends and work kind of like a temporary Band-Aid over the area. Now we're going to start to actually repair the tissue, and that's step 2. And this is going to be with a fibrocartilage callus. And it's called a fibrocartilage callus because it's kind of like a temporary Band-Aid. It's not super strong. And what happens is fibroblasts come in the area. Remember, they make your protein fibers, your collagen, and chondroblasts are going to make cartilage. So you're going to put cartilage and collagen fibers in to fill in the gap, and it's going to start the repair and the healing process. Now, during this stage, you're going to be immobilized. They're going to have you in a brace or a cast because this is filling it in, but it's not super strong yet. And if you're not careful, you could re-break it easily. Once you have this cartilage callus, and we're looking at weeks here depending on the break. It could be anywhere from 2 to maybe 10 weeks depending on which bone is broken. Then you start to go into the bony callus, and the bony callus is literally just like endochondral ossification. Osteoblasts come in, they go into that cartilage, and they replace cartilage with bone. Now you're filling in the area with bone, and it's getting stronger. This is when they're going to have you doing PT or put you in a walking cast because remember, stress is good. Stress will help with the bone healing process. Once the bone is fully healed, again, it could be weeks or months. It just depends on which bone it is and how bad the break was. The bony callus is then remodeled and removed. So if you have an x-ray with a bony callus, you'll see it sticking out. It'll look a little thicker for a little while, but eventually bone remodeling happens and the osteoclasts break it down and the osteoblasts build fresh bone so that you would look at an x-ray and you would never know the bone was actually fractured. Now, sometimes we need a little extra help with these healings, so you have to do a reduction. And a reduction is when you manually put the bones back together again. A closed reduction is when you manually just do it, just pushing on the bones from not having to open the patient up. An open reduction is when there's a surgical procedure, so there's a surgery that's going to happen. Now, there's two ways to fix it, so to speak, internal and external fixation. So this is when we sometimes need pins or screws to hold the bones together. And, in this case with my sons, that screw will be in there the rest of his life. It doesn't come out. So internal fixation is when the screw or the pin is under the skin. Whereas external fixation, you can see, obviously it goes into the bone, but you can see the device on the outside of the skin. Now, from what I understand, the internal is preferred because you have a lower risk of infection. Because remember, anytime you have an opening in your skin, you do have to worry about that a little bit. So my son had an ORIF, which stands for open reduction, internal fixation, which just basically means they opened him up and put a screw in his elbow. Now, a bone stimulator is kind of cool. We talked earlier about electrical activity generating these little fields, and that stimulates osteoblasts. And so we can use ultrasound or electricity, electromagnetic waves, and that does the same thing to help with bone growth. So electric stim and ultrasound can sometimes be used because it may help stimulate osteoblasts and help you heal faster. Now, the jury's out on that. Some research has said that it does nothing, and some research has shown that it's promising. You may have heard of spina bifida before. Spina bifida, here's a normal vertebra, and you can see it's all bone, and then in here would be the spinal cord. Well, in spina bifida, part of that posterior part, it's called your spinous process, that posterior part of the vertebra doesn't form. Now, it can vary to be very, very mild, or it can be pretty open, and you can actually have part of the spinal cord or spinal nerves protruding. So it varies in severity. It's a developmental issue that happens during fetal development, and often there are surgeries that can be done to help correct it. Now, osteopenia is just if you live long enough, your bone density drops. So what we know is as we get older, our bones become thinner and weaker. And this process actually starts in our 30s. So we also know that you can store or stockpile calcium until you're about 30 years old. And so what that means is if you're not 30 yet, eat well, make sure you get plenty of calcium so you can store it in your bones. Once you hit 30, you can't store extra anymore. You can make your bones stronger. You can make sure you eat well and exercise and maintain your bone density, but it's really hard to go back and store. So we know that women lose bone faster than men as they age. Men typically have thicker, bigger skeletons, and it's just kind of a normal consequence of aging if you're sedentary. But osteoporosis is an actual disease. And with osteoporosis, the bones become porous. They become very brittle and weak, and you suffer from frequent fractures. So if you look at osteoporosis, what's happening is the osteoblasts are slowing down, but the osteoclasts continue. So remember, anytime the osteoclasts break bone down faster than the osteoblasts replace it, you end up with weak, porous bones. And now these bones can't support body weight. So sometimes you'll hear someone say, well, my grandmother fell and broke her hip. Well, what probably happened was she stood up and she had so much osteoporosis that the bone gave out. And so the break happened, and that's why she fell. Now, you can have osteoporosis at any age. It's more common with postmenopausal women because once you hit menopause, your estrogen levels drop. And we know that estrogen maintains bone density. It's a hormone that helps keep your bones strong. But if you don't have the estrogen, you can actually become osteoporotic. So estrogen is a fat hormone. It's a steroid hormone. So you need to have 12 to 15% body fat to have estrogen. And if you don't, then you're not having the estrogen, and you're probably going to have some issues with weak bones. So how do you know if your estrogen's where it's supposed to be? Well, you have a menstrual cycle. So if you are menstruating, that means you have enough estrogen. If you are very thin and your body fat's too low and you stop menstruating, that's a red flag that you don't have the estrogen, and so we're going to worry about your bone density. Now, the test that you can do is called a DEXA scan, and a DEXA scan is kind of like a special x-ray and it's done to assess bone density. So it's good to have done if you're at risk of osteoporosis, and you can kind of have it done and keep track of it. So what if you're getting osteoporosis? Well, actually, let me back up. How do you try not to get osteoporosis? Well, things you can do to decrease your risk are, number one, eat well. Make sure you get plenty of calcium, get your vitamin D, get out in the sun 20 minutes a day, or take your supplements. We know weight-bearing exercise is best because weight-bearing exercise is going to use your functional stress of your skeletal muscle contractions and your gravitational stress of your body weight. So the best exercise is weight bearing for strong bones. Now, if there's an issue with arthritis or something and you can't do weight bearing, it's okay to do non-weight bearing like swimming. Even cycling is still good for you because you're still getting the muscle contraction, but the very best is to combine them. We know that estrogen is helpful. So if you're on birth control, that lowers your estrogen. Or like we said, if your body fat is too low, you want to make sure that you have proper body fat so you can have the hormone. And then stop smoking. We know that smoking increases the risk of osteoporosis. So how do you treat it? Well, you do the weight-bearing exercise. You watch your diet and get lots of calcium and vitamin D. And if necessary, there's pharmacological treatment. Now, you don't have to memorize the names of the medications. I just have them in there because you might have seen them advertised. But I would like you to know the mechanism. How do these medications help? So your biphosphonates are kind of like the big ones because they basically decrease the bone reabsorption. So what they do is they slow down the osteoclast. So they kind of slow them down so the osteoblasts can try to catch up. You can get calcitonin given to you. Calcitonin, remember, directly activates osteoblasts. If there's an issue with the estrogen, you can go on estrogen therapy, or you can go on a selective estrogen treatment. So some women don't want to do estrogen therapy because it could also increase your risk of breast or uterine cancer or ovarian cancer. So if you have a history of some of the female reproductive cancers, you might not want to do that. So there's new drugs now that are supposed to just affect the estrogen receptor in bones. So it's supposed to just trigger the bones and reverse the bone density issues from menopause. There's also medications that directly stimulate bone formation. So a new one is out and it directly stimulates the osteoblast. So there's a variety of treatment options as well. And we also know that osteoporosis is genetic, so you can look at your mothers and see if they became osteoporotic, or your grandmothers, you have a higher risk. Also, if you have a very small, slender build. And I just want to wrap up by mentioning that some cancers produce a protein that works basically like an osteoclast. It activates osteoclasts and can cause severe osteoporosis. So it's just something to know in certain cancer patients that they can be at a higher risk of osteoporosis. So this concludes our last lecture on the skeletal system.